But we're pleased to welcome now Marc Goldwein, the Senior VP and Senior Policy Director with the Committee for a Responsible Federal Budget. Hey, Marc, good to see you. Thanks for coming on.
Yeah, thanks for having me.
So you guys have written some stuff lately, provided some analysis of the Social Security and the Medicare hospital insurance funds, the HI fund. And just last week, I believe, the trustees of those programs released reports that move forward, if you will, the date at which the programs become insolvent from the perspective of not being able to meet their obligations in full. And I enjoy all the work that comes from the CRFB. I've been a subscriber, really enjoy that, great analysis. So that's the problem, is it not? We're approaching insolvency without some action.
That's right. I wish I could come on here and give you good news, but here's the reality. Both the Social Security Retirement Program and the Medicare Hospital Insurance Program are 8 years from insolvency. The trustees estimate 2033 is when both those trust funds will run out. That may seem far away, but think about it this way. That's when today's youngest retirees are 70, right? So most people that are collecting benefits today, whether Social Security or Medicare, are still going to be collecting benefits when the money runs out. And when the money does run out, things don't disappear, but they do get cut pretty dramatically and pretty across the board.
Estimated to be as much as 23%, correct?
That's right. The estimate is that, so here's the rule. Social Security can't pay more than it has. So when the trust fund runs out, it can only pay out of the taxes. And the estimates are, that'll mean a 23% across the board benefit cut. For a typical couple, by the way, that's almost $18,000. And then for Medicare, it's another 11% cut. And that's going to be felt by hospitals and doctors who probably will respond by trying to not take Medicare patients.
Yeah. And let's explain this for the audience. I'll just give it a try. So you've got current employees, workers who pay into Social Security and the hospital insurance. It's Medicare, HI is what we call it. They pay into it. That covers the majority of the benefits. But then you've got some interest earned in at least the Social Security Trust Fund on the amount of surpluses that when it has those, it loans to the Treasury. Treasury pays that back. It's what? Last I checked, 3.8%. It's no major amount. And if all of that, and then you got some taxes, by the way, that are collected on Social Security benefits that also goes into the kitty to pay benefits. But if all that doesn't add up to cover the total benefit obligation, the programs dip into essentially their savings account, the trust fund. What we're saying here is we're not collecting enough to make benefits. We're having to dip into the trust fund, and it's being depleted at a more rapid rate than was forecast even just last year, the pace just last year. Is that in a nutshell what's going on here?
Yeah, that's basically it. And look, the program was never really intended to have a big trust fund to pay out for many years. The trust fund was supposed to be to smooth out variation for recessions and things like that. But we've been increasingly relying on this trust fund to pay benefits. So the revenue isn't covering the cost. A lot of the money isn't coming from the trust fund. And that means that when the trust fund runs dry, all that money we've been counting on is no longer there. And that's where that 23% benefit cut comes from.
I got you. Yeah. So, there are a number of different ideas, shall we say, on how to address this problem, all of which have to come from Congress. I mean, they're the ones that would have to reform the programs. And the challenge, Mark, we have there is that in the Senate, for the most part, anything significant would require 60 votes.
That's right. Any real solution is going to require bipartisanship, unless one party has sort of dramatic victories in the Senate and the House and the White House. And look, that's how it's always been done. In 1983, the last time we saved Social Security, we extended its life for 50 years. We did it because President Reagan and Speaker O'Neill, came together in a bipartisan deal. That's how it's going to have to be.
Yeah, but there doesn't seem to be any consensus, any alignment among the parties, right? I mean, the Democrats have bills right now, all of which include raising taxes significantly. Scrap the cap. You've seen the campaign, which essentially just eliminates the threshold right now at, $176,000 on an annual basis. After that, workers don't pay into Social Security. They want to scrap that. There have been some proposals to create kind of a donut, ended at 176, but then pick it back up over 250. You've seen that. All of their proposals deal with just increasing taxes on the same people that would not receive any more benefits for paying those taxes. You've seen some Republican interest in increasing the retirement age. That's about all I've seen. What else?
Yeah, so there's not a lot of heroes right now in the House or the Senate, but we're 8 years away. And as the crisis gets closer, I think the interest will as well. In 1980, I keep going back to it, but in 1983, the trust fund actually ran out of money. It was
Right.
borrowing, we let it borrow from Medicare. So it was already past insolvency by a few months, and that's what it took to get the policymakers to come together. It would have been great if we could have done this by leadership. There was opportunity to do so in the 90s and 2000s. Newt Gingrich and Bill Clinton almost had a deal. George Bush tried really hard. I worked on the Simpson Bowls in 2010. We had, I think, a very reasonable package. But we're past that. The politicians have ignored us too long. And so now it's probably going to be sort of more of a crisis package. Hopefully we can do it a few years in advance instead of, a couple months after it runs out.
Mark, having not been able to advance any of those ideas that you just described through the years, does that make the problem even more difficult to solve?
Yeah, look, if we had done this back in the in 2005, let's say, Republicans could have solved the entire problem with their preferred solution, just have benefits only growth prices. Democrats could have solved the entire problem with their preferred solution, just pay taxes on all the income. That's no longer true. Neither of those policies would solve it. The problem has gotten bigger because we've been able to spread it over more people, and we now have less time to phase it in. Again, back in 2010, when I did Simpson Bowls, we phased everything in by 2050. It was a 40-year phase-in. If you were to try to do that today, you'd have to do a 5-year phase-in.
Right. Wow. So the idea, Mark, of investing the trust fund or the program's assets, both programs' assets, in securities other than what they're very limited to today, the special bonds, the S bonds, for example, in Social Security. I mean, instead of a 3.5% return, 3.7% return, we might be looking at standard S&P 7-8% returns. That would provide a huge boost to the programs.
Yeah, so if we had invested the trust fund back in the 1990s or 2000s, it could have significantly extended the life. With more risk, by the way, right?
Yeah, sure.
More increases, more risk. But at this point, we are drawing from the trust fund so fast that it's not going to do much of anything, right? It would put that money at jeopardy. That we need all that money over the next 7 years. So we can't make those long-term investments unless we were to first get the program back to solvency.
Yeah. That's a good point because we don't have like a lot of just static, idle assets to go out and invest and park for a long period of time to generate interest. We need that money to pay benefits, so we're limited to very short-term type investments. Well, in the case of Social Security, you only have one investment.
That's right.
Right? With the S bond,
Medicare
that's
too.
it. I think
the same thing. Yeah.
Yeah.
But
exactly.
it just wouldn't, at this point, it just wouldn't make much of a difference however we invested it.
I see. We should have done that when Bush tried to do it 15 years ago.
Yeah, both Clinton and Bush tried to do it in different kinds of ways. Clinton wanted the trust fund invested. Bush wanted individuals to have their own accounts that were invested.
That's right.
There was always problems with both of those ideas, but I think they were all also very promising ideas. And with the benefit of hindsight, we would have been in a much better situation now had we done it back in the 90s or 2000s.
Mark, you know this politically, nobody wants to talk about this. I mean, even the president says we're not touching it, we're not talking about it. But this latest report from the trustees really got the attention. I haven't heard anything, honestly, from Congress, the people who can fix this. I haven't heard much response to that. But folks like your organization and countless other financial media sources have all reported on this recent trust fund report.
Well, what I'm worried about is that not only are politicians not touching it, they now are actively making it worse. So last year, on a bipartisan basis, Republicans and Democrats came together to make the situation worse by essentially letting some state and local retirees double dip from their Social Security and their state and local alternative. Now, again, Congress is working to make it worse, this time on a partisan basis, through various tax cuts that don't directly affect Social Security, but they do indirectly affect it because they reduce the money we get in from taxation of benefits. And so not only are the politicians ignoring this, they are now actively making it worse. And by the way, tariffs will make it worse as well too, because they'll increase the COLA costs. So we're moving in the wrong direction, and it's very discouraging because, man, that deadline is coming pretty soon.
Mark, we got a break right here. If you can hang on, we got another short segment, 8-10 minutes after the break. We'll keep talking about this.
Sounds good.
All right, we're coming right back to the studio. We're visiting with Marc Goldwein. He's the Senior VP and Senior Policy Director, Committee for a Responsible Federal Budget, talking about recent reports from the Social Security program and also the Medicare program indicating that they're slated to become insolvent a little quicker than was previously thought. And that's got lots of folks talking about it, including the CRFB. All right, so, Mark, what do you think they'll take any action in this term, in this 4-year period? Because as you indicated, we got 8. Well, that's 2 terms, right? So
yeah, they should. We should have done this again in the late 90s. My guess is they won't, and if they do, it'll be in the last 2 years. There is something freeing about a president that's not running for re-election with a Congress that isn't facing immediate election. So that's what we saw. President Clinton tried to do it in his last 2 years. President Bush tried to do it in his second to last 2 years. So I would say it's not impossible, but I'm not holding my breath.
Well, have you heard anything as your organization, any of your analysts? Have you heard anything specifically from any members of Congress? The only one that I can think of in recent memory, other than the Democrats who have been proposing to raise the taxes, the contribution payroll taxes, Rick Scott. He talked about raising the retirement age. A couple others have as well. He also proposed, kind of floated an idea that Congress ought to have to authorize these mandatory programs every 5 years, I think. Just, put them out there on the table and make folks consider all the various issues that are concerning those programs and cast a vote. Anything else?
So I'll tell you a little secret. There are dozens of members of Congress, House and Senate, that have worked with us over the years to design Social Security reform plans.
Okay.
And then they take those reform plans and they put them, right in the trash can or right in the secret filing cabinet to never be seen. There are a lot of folks that want to fix this, that want to know what would their plan be if it came to it, but are terrified of the politics, right? And so they design it, but they never talk about it publicly. And that's true in both parties. And it's really unfortunate. The politics is so toxic that even mentioning something like, people ought to work a year longer, 50 years from now, can get you attacked by all these groups.
Well, you're right. Rick Scott absolutely got lambasted, right, by Democrats in particular. He wants to end Social Security. No, he's trying to protect it. He's trying to ensure its long-term viability, and that's how they construed the mere proposal of perhaps phasing in a higher retirement age.
Yeah, and the Medicare discussion is even more funny because actually in Medicare, the parties basically share the same policy ideas. But when one proposes it, the other attacks them. And then 2 years later, they propose the exact same thing, and the other one attacks them. So the Medicare is even more, at least with Social Security, we have a difference between these folks want taxes and these folks want benefits. On Medicare, they basically agree on what to do, and yet they still attack each other.
So the last time, clarify this for me, Mark. Last time I looked at this, it appears to me that Medicare's receiving funds from the general fund right now to make ends meet. Is that correct?
So there's 3 different parts of Medicare. There's the hospital insurance trust fund, and that works like Social Security. The payroll tax goes to pay it, and that's going to run out of money in 2033, latest projections. But then there's 2 other parts of Medicare. Medicare Part B, that's basically your doctor's visits, and Medicare Part D, that's your drugs. And those are never funded out of payroll tax. They're funded through a combination of premiums and general revenue. But that general revenue is growing over time. And so even though they'll never be insolvent, they're imposing on a higher and higher cost on the taxpayer on the federal government and leading to more and more borrowing.
Yeah, I was going to say, which means we're borrowing money to make ends meet in Part B and Part D, right?
That's exactly right. I mean, as a country, we're borrowing $2 trillion a year. That's not all for Medicare, but the Medicare growth is a big contributor.
Unbelievable. And it doesn't seem like that it's going to reverse that trend anytime soon. We're living longer. Healthcare costs are up. There's a whole lot more healthcare to buy, essentially. We keep inventing new care, which is a good thing, but it costs money.
Yeah, I'll tell you the good news. It's going to sound like bad news, but it's good news. There's an incredible amount of waste in our Medicare system. I know you think that's bad, but what that means is there's incredible opportunity to lower costs without actually cutting benefits, without meaningfully or significantly reducing access to care or quality of care. And there's lots of ideas out there with broad support. There are ideas that Elizabeth Warren and Newt Gingrich agree on. For example, we ought to pay the same for something that you do in a doctor's office as a hospital. Right? It's called site neutral. Why we pay hospitals more right now makes no sense, and it causes the hospitals to buy up the doctor's offices just for the higher rates.
I've seen that. Good point. Yep. Mark, appreciate you coming on. Really appreciate all the work and the analysis you guys do, and just keep hammering away at it, man. We got to address this problem. Thanks a lot.
Thanks so much. Thanks for having me.
You got it. You got it. We're coming right back, folks. It's time for Fox News. It's SuperTalk News. It's top of the hour. Don Redman with AAA Mississippi is next.